Medical technology is advancing at such a rapid rate that some parents are now choosing to have their baby's cord blood stored as an insurance policy for the future. The blood in the cord is full of stem cells, which have the potential to grow into different types of tissue, which is perfectly matched to the baby. As yet, the technology is in its infancy, but over the next few years, science may work out how to use these cells effectively, which in turn could save lives.
It came from when my wife was expecting her first child. Basically, I wanted the cord blood collected, not being an academic scientist at that time. I knew the potential benefits that would be coming around the corner in the future. And I couldn't find A, what I was looking for in a company in the UK, and B, either couldn't afford it, having it done in the companies I could see them doing it the right ways. So I was in a very fortunate position that I could do it myself, because I had the facilities in the lab where I was working. And as time went on, more and more people were approaching me to ask me to collect the blood for them. I linked up with Dr. Davies, who was the medical director, and we decided there might be some mileage in setting up a small company offering the service that we were looking for.
So this is the hood that we use to process the blood in. So we will check the blood bag, which is just a standard blood collection bag containing anticoagulant. It's been knotted and clamped. Cryogenic tubes, which are necessary to store the samples at liquid nitrogen temperatures. So the majority of the blood is stored in the cryogenic storage bags, but we do take aliquots, smaller portions, which will allow parents to test to see if there's compatibility if they wanted to use the blood to treat somebody other than the child from whom the blood was taken.
Well, currently the uses of umbilical cord blood for treating autologously, that means giving it back to the child from which it came, it's very unlikely to ever be needed. But there's more and more research ongoing now with cord blood, which shows that it has every potential of being a widely used therapeutic. Currently, the uses would involve repairing a damaged immune system. For example, if a child is given leukemia treating drugs, their immune system will be quite severely knocked about. You can then repopulate the immune system using umbilical cord blood. A transfusion of umbilical cord blood will give them a new immune system. And that's probably the only use for it at the moment, but there are studies in the literature looking at the reformation of organs, repair of spinal damage, etc., heart disease. Lots and lots of uses are just below the surface. So in the next perhaps 10 to 15 years, I'm absolutely convinced we'll see a very heavy use of cord blood stem cells and stem cells in general.
The samples are transferred to the pathology lab, where they undertake bacterial culture and the maternal disease marker testings, which are required by law. When those results have been approved by the pathology lab, they're then communicated back to us, and we collate them with everything else and issue certificates or refunds as appropriate to each customer.
The majority of companies look for what are termed CD34 positive stem cells. Now, they are the stem cells which repopulate the blood and immune system. The true stem cells are CD34 negative. They're the ones that have the potential to develop into any tissue. And there has been reported in the literature now of the cells being able to differentiate into nerve cells, muscle cells, etc., etc. So yes, in theory, they can form any part of the body.
When Meg's son Jack was born, her doctor took blood from his umbilical cord that is now stored both here in the UK and in the United States of America.
When I was about 5 months pregnant with Jack, I was on the internet talking to a friend of mine in the US who's also pregnant at the time. And she had asked me which company I was going to go with. It wasn't a question in her mind if, it was which. And I hadn't even heard of anything to do with cord blood storage. I'd heard a lot of things about stem cell research. There's quite a bit on the news about it, but was intrigued by what she was saying and Googled it and started reading about it. And when I was 7 months pregnant, I was in the US on a trip visiting family and friends, and I had several friends that had just recently had kids or were pregnant, and they were all talking about it. It was the big buzz, and I realized that, you know, there are things that are trends, but this is more than a trend. It's a life insurance policy for your child.
The 5 ml samples that we take are designed to allow these to be used for a therapy which is just entering into clinical trial stage called stem cell amplification. It allows quite a small volume of blood to be amplified up so that the stem cells become greater in quantity.
But there are companies, especially in the States, that do have cell factories for amplifying the numbers of stem cells. So even much less than 30 mils in the future could potentially be of benefit, that they can be amplified because they have unlimited amplification potential, you see. So you can have a situation where even 1 mil could be amplified up into perhaps several litres worth of stem cells. But the techniques are not quite there yet, but they will be.
If he ever needed a bone marrow match, if he had cancer, he has his match waiting for him in a vault. We wouldn't have to go looking for a match.
The final package is then put into a controlled rate freeze box which is validated, and this enters the -80 freezer where it is slowly frozen from room temperature down to -80 degrees. This is important so that it does not compromise the cellular viability of the sample. If you were to rapidly freeze the samples, then they would actually degenerate and you would end up with lots of cellular damage.
On top of that, it's a 1 in 2 match for my husband or myself if we ever got cancer, and a 1 in 4 match if Jack ever had a sibling. So, and we could carry the matches through the family as well.
The cost is something which upsets us probably more than our customers. It's $1,495 currently for the full service for 25 years. We are trying to bring the cost down. As the scale of customer goes up, then we anticipate bringing our costs down. Unfortunately, we've got to operate semi-commercially because we've got to pay our bills, etc. So all of the cost is pretty much front-loaded. It's not really expensive to store the blood, but it's expensive to process the blood. That's the unfortunate reality.
I would do it again in a heartbeat, and everyone that I know who is expecting, I sit them down and I tell them about it, and I send them to the website. I'm not pushy about it. Obviously, it's a private decision, it's a personal choice, and it's financially something that they have to consider. But I haven't recommended it to anyone that I know who hasn't gone for it. After you read about the benefits, and there are no risks, it's after he's delivered, it's the umbilical cord the part that's snipped off. I mean, it's something that's going to be thrown away. So when you consider that something that's going to be thrown away can save your child's life for his whole lifetime, it can conceivably save another member of your family's life, and doesn't cost very much money, it's kind of a no-brainer. Yeah, everyone that I've shown has gone for it.
So, if you're interested in cord blood storage, you can find out more by using the internet.
My little girl was the first cord blood unit to be in there, and my little boys was about the couple of hundredth, but they're both in there now stored. It gives me quite a warm feeling to know that they're there, really. I hope they never want to be used, but it's nice to know that they're there.